everybody. It's great to be here. I'm Grant Colfax, the Director of Health, and very excited to welcome you on this extremely exciting, inspiring, and important day, the launch of the I Am Living Proof campaign in San Francisco. I'm really so happy to see so many people here from across the recovery and care community, and from communities that are most affected by the overdose epidemic. I want to thank Supervisor Dorsey for joining us today. Supervisor Dorsey, as you all know or should know, has been a leader in recovery and ensuring that driving us at the health department, along with so many other policymakers, to continue to do better. And I want to thank all of you for pushing us to do better, right? We continue to evolve, we continue to change in the face of data, and most importantly, we are focused on listening to community, because we know community's voice is the key to success. We saw that with HIV and our success with the HIV pandemic. We saw that during COVID, and we know that's also the case in this situation. I would also like to thank Commissioner Christian for joining us, Health Commissioner Christian. The Health Commission is the governing body of the Health Department and has, from the very beginning, focused us on ensuring that we do better in behavioral health. And at almost every Health Commission meeting, they're asking us, what are you doing next? Tell us the data, how are we improving? We're excited to launch the Living Proof campaign. And the purpose of this campaign is to educate people that treatment and support services are possible in San Francisco to help people with fentanyl addiction and other substance use disorders. We just really want to emphasize that this campaign is getting the message out that help is available, that treatment is available, that we have medications that reduce the risk of death by over 50%, and help support people in sustained recovery. The campaign features 9 very inspiring people who are in recovery, some of whom are here today, and they're going to tell you about their stories. They have found success in treatment across our spectrum of care: medication treatment, residential treatment, outpatient treatment, and counseling. And I want to thank them personally for being role models in this work, and I applaud each of you for being here today. Thank you so much. Now, we're doing a lot at the Health Department in partnership with many of you in community. I did just want to give a specific example of something that we just recently launched, which is on-demand buprenorphine treatment 16 hours a day in San Francisco. This is a new program that many people have worked on in community when we were out on the streets, talking to people suffering from fentanyl addiction and talking to community partners. There was a need for people to be able to get treatment right then and right there. Right? It wasn't enough to say, for most people, for many people, it wasn't enough to say, oh, go to a clinic that's opened at 8. Or go to a clinic that maybe it's now open to 7, that's a good thing, but some people just are not going to do that. So we have launched an on-demand 16-hour buprenorphine availability. So anybody in San Francisco can now call, reach a medical provider, get a treatment plan, and prescribe buprenorphine. This is the first program like this in the state. On-demand, 16-hour buprenorphine. It's available from 8 a.m. to midnight every day. And this and other interventions are associated with some good news, which is that overdose deaths have been declining as we get more people into treatment and into care. This year so far, compared to last year, overdose deaths are down 20%. Now, certainly we have more work to do, and certainly far too many people are still dying, but we are making progress. And this campaign is part of that progress. We hope and know that the Living Proof campaign will help direct more people to life-saving treatment services and also destigmatize treatment and recovery. And Supervisor Ronan has just joined us, and I want to thank her for her support through the years from the very beginning. Getting us to do better mental health SF, adding more than 400 new treatment beds in our system of care. Thank you. This work saves lives, and it's time to hear from the people who are making the difference. So first, I'd like to welcome Dominique McDowell to the podium.
How's everybody doing today? Good. Everybody good? We good today. First, I want to give glory to God first. You know, that's what I got to do first. I'm Dominique McDowell.
You lost sound.
You lost me?
Lost the sound.
Sure.
All right. Keep talking.
Oh, okay. A, B, C, D, E, F, G, H, I, J, Q, R, S, T, U, V, W, X, Y, Z, A, B, C, D. I can hear myself.
There it is.
There it is. All right. Anyway, I'm Dominique McDowell. I was born and raised in Bayview. And I started using crack cocaine at 15, based on loneliness and neglection. I want to acknowledge my dad, though. Oh man, I'm gonna cry. I want to acknowledge my dad for all I put him through in life. He never, ever shut his door when I knocked on him. When I had nowhere to go. Nowhere to go. Everybody else shut their door. I had no friends, no nothing. I don't know if anybody can know how that feels. To feel hopeless and where nobody wants you around. I'm certainly proof that recovery works. I know that. I know that I've been blessed with friends, colleagues, and people in my life that supports my recovery. You know, it took a long time for people to understand my recovery that was in my life that wasn't about recovery. And it's funny because everybody in my family understands now. People are even like, if I come to a party, they start thinking like, oh, Dom here. Like, people don't want to do things around me. That's how much they understand how much this means to me, to not do it. I don't try to stop people from doing things, but I appreciate that. I appreciate what recovery has done for me and the stance that it's given me in my life. I'm very grateful for the process of recovery. I'm very grateful for people that were patient with me in my life. You know, people that were real patient with me. At this critical moment, I just want to amplify how important it is for us to be seen, for us to be heard, for us to be helped, for us to be loved, for us to be appreciated. This is a tough journey that we cannot do it alone. I tried it alone for many years, and I ended up alone. So, I'm very proud of this campaign, and I know that you probably don't want me to do this, but I wouldn't be here today if Dr. Saran wouldn't have took a chance on me and hired me for a job. She connected me to all of this. It's through her that I'm here connected with you all. Thank you, Christy. I'm very proud of my dad in his recovery. He done it the tough way though. He done it tough. And I respect that. No treatment, no nothing. Just hard up to it. And I didn't understand why you left me alone using drugs. Like, why you stop? You know, it was, but now I understand. Because you need to lead me somewhere. You need to lead me to a positive place and let me see something positive. And I don't think he know how much that meant to me. I was watching him. He's all I really had. Right? So, I'm gonna end on this note. Because I can talk a lot. Right? So, there's 4 reasons people change. People change when they're hurt enough that they have to. When they've seen enough, they're inspired to. When they learn enough, they want to. And when they receive enough, they're able to. Thank you.
I've used drugs from the age of 15 till 29. I had no friends. I had no family. I wanted to quit because I didn't want to die. And since I've been in recovery, I could write a novel of the good things that happened to me. I finished college. I've held great jobs. My dad was back in my life at this time. Recovery is possible if you let help help. It's never too late to recover from addiction. I have been proved that recovery is possible.
Thank you. Thank you, Dominic. It's quite a video. And we're going to see it all over the city, all over social media. And tell the people you know to call the number, because we have treatment available on demand. And speaking of demanding treatment on demand, it is my honor to introduce Supervisor Dorsey, who we all know is a champion in behavioral health and recovery.
Thank you so much. My name is Matt, and I'm an addict and an alcoholic. And as I stand here today, I have 4 years, 1 month, and 5 days clean and sober. But it occurs to me that as I was talking to Dominique when I came in, if I had stuck with my original sobriety date, I'd be on the cusp of celebrating 33 years. I've spent most of my adult life in recovery, and I've had setbacks along the way. And I think if there is a message that I would say to my brothers and sisters and non-binary siblings in recovery, it's to, it does work, and treatment works. What we got today, and tomorrow we got to work on it again, and we got to keep it. And the way we keep it is giving it back and working with others. And that's why when I came in and I was so excited to meet Dominique, and the first thing we did was exchange numbers, and we're going to a meeting together. That's how this works. I want to express my gratitude to the Department of Public Health and Dr. Colfax and Dr. Cummins for your leadership. To my colleague, Hillary Ronan, who was long before I ever got to the Board of Supervisors, has been doing this important advocacy and this work that really is life-saving. It was the convergence of a public health crisis and drug overdose deaths in the city, in my own journey in recovery from addiction, that moved me to ask for a job that I never thought I would want, let alone have. But I was working in the police department back when we had a monthly meeting where I represented SFPD to preview the monthly report on how many people died of drug overdose deaths that month. And month after month, I sat there on the monthly death call, looking at a number that I know I'm one bad decision away from being in. And that's why when there was a vacancy in District 6, I asked the mayor to consider me as her appointment. And I want to give a shout out and express my gratitude to Mayor Breed, because the day that I asked her to appoint me to District 6, I only had 18 months of sobriety. I was literally celebrating 18 months that very day. And I had to acknowledge to Mayor Breed that I didn't have enough continuous sobriety to be a treasurer in a 12-step program. And I was asking her to give me a lot of responsibility. There was a lot of risk, and there's no small number of people who would advise her to not take that risk. There's a lot of people I've let down, my parents included, but also colleagues and bosses and friends. And to London Breed's credit, she took that risk and she gave me that appointment. Then District 6 voters did too. I will never forget there was a meeting that I was in when I was being considered. And I was sharing every week for a few weeks that, I'm interviewing for a job and I have a lot of anxiety about it. I wasn't sure if I was going to get it. I didn't know if I would do well with it if I did. And then I was appointed to the Board of Supervisors, and the next time, a couple days later, I went to that meeting, and the reaction was, that was the job you were interviewing for? But I got a call afterwards from somebody in that meeting, and we have seen each other go through hell and back together. And he called me, and with more joy than I've ever heard in his voice, he said to me, now we've got a seat at the table. I still choke up when I think about that. And it is something that I carry with me. Giving the recovery community a seat at the table. And we have to give, back too. This is one of the nice things about putting the recovery community in the game is taxpayers aren't gonna spend a dime on the work that we're gonna do, but make no mistake about it, the recovery community is gonna do the work to make sure that we're taking care of each other. So I just wanna say from the bottom of my heart, my appreciation to you, Dr. Colfax, to you, Dr. Cummins, to you, Supervisor Ronan, to Mayor London Breed, and to everybody in my brothers and sisters and non-binary siblings in recovery for doing everything that you do to keep me sober. I will always be there for you. Thanks so much.
Thank you, Supervisor Dorsey, and of course we look forward to continuing the journey together and look forward to your ongoing leadership to push us to do better. So our next speakers are two more examples of the effectiveness of treatment and the promise that treatment holds. I'd like to ask to come up to speak Juliana Gruola Nuno and Michael Alvarez. Thank you so much.
Hi, I'm Juliana, and this is my partner, Michael. 3 years ago, on November 14th, 2021, we had our daughter, and that's when our recovery journey started. Because of our addiction, we didn't know that I was pregnant until I was having our daughter, Paloma, and we knew instantly that our lives had to change for her sake.
Juliana and I fell in love while going to electronic music festivals. Our addiction started with party drugs, then later turned to Oxy. And before we knew it, we had a serious opioid addiction. We found ourselves homeless, jobless, and disconnected from our friends and families. Our lives revolved around fentanyl.
We found so much amazing support and resources in San Francisco through the public health department, starting with Team Lily. And we also were helped tremendously by the Health Right 360 program, Women's Hope, Walden House, Homeless Prenatal Program, Hamilton Families, and Family Treatment Court, and surprisingly, Child Protective Services.
Today, we maintain our recovery with methadone. Juliana goes to SF General OTOP and myself at BART program. Because of all our support, we are thriving as individuals and as a family. Paloma is a healthy and happy, and we just celebrated her 3rd birthday on Sunday with family and friends, as stressful as it was. I am working as an intern as a community health worker at Homeless Prenatal Program, and I'm also co-facilitating fatherhood groups on Fridays.
And I go to City College of San Francisco studying to be an addiction and recovery counselor. We both we're so inspired by the many people who helped us through our journey that we want to give back to the people who are still in the space that we were once in.
4 years ago, we would have never imagined having a beautiful daughter or a nice home to live in. We want people who are using fentanyl or any other substance to know that there are a lot of opportunities to recover from drug addiction. That it's possible to change habits and behaviors and to have a meaningful life without using substances.
And that's why we decided to participate in the Living Proof campaign.
We are living proof.
When I was in the height of my addiction, I did not see a future. I constantly would question if this is all that I was meant to be. I was inspired to quit using when I found out I was going to be a father.
We were just like, if we're gonna have this kid and she's gonna be with us, then we need to take the help right now. Since we stopped using, our life is like night and day. I'm able to withstand cravings. I don't have body aches.
That can be anyone can do it.
We are living proof that treatment works.
Thank you, Juliana and Michael. I know Mom is here as well. And this is where I just wanted. I also want to put up our hiring, our hiring website. So, just because we're ready when you are. We're ready when you are, because we know it's so important to have people with lived experience in our system of care. Because as you've already heard today, it makes the system work. So thank you, and we look forward to engaging with you in the future. Thank you. So our last speaker is somebody who has led so much of this effort, and she came to San Francisco 3 years ago, and when I was looking for a leader of behavioral health, the job is tough. There's a lot to do. It's hard work. And there is a city in the country that, toughness pays off. That's New York City. And from the minute I made a call and said, are you interested in making moving across the country to do the work, she said yes. And I'm so proud to support the work that she and her team has done. She's brought new leadership, new perspective, a data-driven focus with a focus on also engaging with the community and making access to care as simple as possible and clearing out the bureaucracy whenever possible. Dr. Hillary Cummins,
Thanks, Dr. Colfax. That's very nice. So I am Hillary Cummins, Director of Behavioral Health Services and Mental Health SF, San Francisco Department of Public Health, and indeed, born in New York City, spent most of my career there, and I don't know, this is a pretty tough town too, it turns out. But a wonderful place, and I think today is exactly showing how wonderful it is. So to the 9 speakers and your extraordinary words and images and willingness to participate, I just want to say to all of you how important this is to me personally, to all of us working in the bureaucracy as administrators, as clinicians, as data people, to center and hear all of your words and stories, because this is what we work for and who we work for, all of you. So the city is so lucky, San Francisco is so lucky that you have been willing to step in and show off your amazingness as humans and the rich and beautiful lives that you have as San Franciscans. And I'll also extend that to Supervisor Dorsey as well, so thank you. I want to sort of end with a bunch of thanks, because this work and today and all of the work the health department has been doing under Dr. Colfax's leadership really takes a huge village. Many folks who are here today, thank you so much. Many folks who are not here who also contributed in numerous ways. I want to extend some special thanks. First to Louis Ramos at OTOM. Donna Hillard, who I think is not here, from Code Tenderloin. And Keller, Faro. Those three people, as you heard from the front row clapping, are responsible for recruiting all of you to this campaign, so thank you. I also want to extend our team's appreciation to sf.gov TV for their incredible work and the extraordinary photographer Russell Yip, I don't know if he's here, for these wonderful images. Thank you to the team at Lyft for their partnership adding living proof to their in-ride advertising. How cool is that? Civic Edge, who partnered with us, I would say tolerated us to bring this campaign to life, and to DA Communications for their support. The team at DPH in communications, in behavioral health, and across the department has had a piece of this work. This has been such a full of heart effort from the comms team and from behavioral health, and this is so meaningful to all of us from DPH to be here with all of you today. So many of the people in the room today work every day living their recovery, working in systems and services to support people with substance use disorders and to keep people alive, to live another day and to achieve recovery. You know that sometimes it can be a long road and sometimes with setbacks for someone who seeks help. And although we have services available, there are people in our community who don't know where to go for help. Or maybe they believe that recovery is for someone else, not for them. So our goal with the Living Proof campaign is to give people the information, the hope, and the direction. And Don, you said it really beautifully at the end. What are the 4 things that folks need? So this week and next, you will start seeing these wonderful images on billboards, bus shelters, muni buses, social media channels. And we are asking for your help. Tell your friends, family, colleagues to share the campaign in their workspaces and their other recreational and other spaces they move through. We have 11 fantastic 11 by 17 posters on the back table for you to pick up and hang, and we'll have more distributed in upcoming weeks. And by sharing this information, you will become a important part of this campaign, and we need all of you to help us get the word out. We so much appreciate everyone's partnership who's here today, and again, huge thanks to the 9 of you who told their story. We really honor you and really are so grateful for your work. This concludes our event. Big hand.